They also have an alert feature there where they can put in a phone number of a person nearby, and if they're having an aura, they can just click on it, the location goes to the person, and the person can address it as fast.
Epilepsy stigma is a huge issue. And given that this is the country with the most people who have an epilepsy, approximately 10 million people, India certainly has a challenge. Today, we chat with the cool neurologist, Dr. Bindu Menon, who helps people in rural parts of the country, which is the majority of the country, be diagnosed, access medications, take their medications, understand that their epilepsy does not define who they are, and help them to live fruitful lives. If this is something that you are interested in and you're one of the 90% of our regular listeners that don't yet subscribe, please do consider subscribing to our channel today. Just click that subscribe button and hit the bell for notifications, and we're there.
It's so wonderful to be with you. You have been such a pleasant face on social media, and it's so good to be with you. Yeah. Torie, I am based in South India. I'm a neurologist. I also run my foundation, Dr. Bindu Menon Foundation. Now it's almost, 12 years of its existence. And the basis of the foundation is to spread awareness and to bridge the treatment gap of predominantly two diseases, epilepsy and stroke.
It's important to mention, I think, isn't it, that epilepsy and stroke often come hand in hand, right?
Yeah, I would put it this way, that the epilepsy and stroke, both of them, actually the number of patients living with the disease is huge. Like 1 in 100 in persons with epilepsy are there in the country. It's almost 50 million people. Out of that, 10 million are in India. Stroke is also very huge. And having said that, we know that the number of patients who develop stroke, the morbidity of the disease, and the patients and the caregivers suffering is also too huge. Both of them are not interlinked in a way, but then some of the patients with stroke might have post-stroke epilepsy as well. So in that way, that is linked. Otherwise, they are separate diseases on its own.
Yeah, and why do you think the numbers are so high in India, sometimes compared to other countries? I mean, obviously your population is huge, but apart from that...
Rightly put, actually, the number is very huge. And I would say that there are certain form of preventable forms of epilepsies, which was very high. And now I'm happy to share that, yes, the number is coming down. So if you look at that, the one is the perinatal injury, the perinatal infections, the infective forms of epilepsy, the neurocysticercosis, tuberculosis, Japanese encephalitis, the meningoencephalitis, that's the communicable form of diseases probably which are also contributing to a part of epilepsy. Also the cerebral palsy that I mentioned, because the form of delivery that was followed at some point of time was sort of indigenous. Now things have changed with the government bringing in the maternal and the child health care into the country. So it's not as bad as then. Having said that, I'm seeing less and less of neurocysticercosis over a period of 2 decades, I should say. They're very, very less now. So the numbers might change if one really does good. And then head injuries, I shouldn't be forgetting that. So the stricter rules needs to be followed to see that post-traumatic epilepsy, remote symptomatic epilepsy also comes down.
And so you work a lot with rural communities with your bus. And so why exactly are there, at least at the moment, higher rates of these diseases in the rural areas?
As you mentioned, yes, that's our flagship project, Torie, that is the Neurology on Wheels. Again, I feel that the number of patients who are diagnosed with epilepsy, but then they do not continue the treatment with epilepsy. That's not the primary treatment gap. I would say it's a secondary treatment gap. They know they have epilepsy, but then after they take the medications, either it's because of accessibility to the physician or affordability of the medications, or just stigma of the epilepsy, that if they go to a center, let's say a community health center, they would be spotted that they are having epilepsy, and then the prospects of marriage, education, and other things become a little bleak.
I was in Mumbai a few years ago doing a talk on epilepsy, and yeah, it was amazing. And one lady came to me and she said, do you know what? I can't tell anybody that my brother has an epilepsy because nobody will marry me.
The marriage is an issue. Sometimes the job, employment is a big issue, because if you get to know, then you're not even appointed. If you get to know later, maybe because of the skill of the person can sort of maneuver his way into the employment, but then it becomes a marriage is definitely an issue, Torie. Here. That's it's usually hidden, and especially the women. It's the opposite for men. Sometimes, if the man marries, the epilepsy vanishes. But if the women cannot vary. So there's sort of that sort of shadow on that marriage is still looming very high. Rest, it's looking brighter now. Yeah. So the employment as well as schooling, colleges, the people around, they're hearing more and more of it. So it's looking brighter now.
That's so good. We need that inspiration, and that's really positive. But I guess it wouldn't happen if we didn't have clinicians like yourself going out into these communities, reaching. That's because there's a tendency, and I think this is global, to have the best clinicians, or the most clinicians, should I say, in urban areas, right? And often it's the people in the rural areas who often, on average, might be poorer financially. And so it's so important, I think, to go out into these rural areas.
There's a huge urban-rural divide, Torie. There are no neurologists in the rural areas at all across the country. So it's a bottleneck, So there's such a segregation, in a small... in a small population, there would be around 20 neurologists here. And if you look at India, predominantly being rural, you do not have a super specialty care there. So the primary health centers do a good job. The primary health doctors do a good job. They dispense medication, look at the patients. But sometimes the patients are not so much convinced, and then they stop taking medications because... so probably the level of awareness which has been told to them might not be to their satisfaction, or the need of taking the medication properly, compliance, everything, the advice which you realize that it is absolutely important for any disease, especially epilepsy.
Yeah, and it's not like you can just forget in the morning or something. You have to, it's not like other drugs. Right? I was speaking to a clinician about this recently who compared it to another drug for another disease and just said, with the epilepsy, you can't forget it. You have to be almost regimental about it. Do you know, you reminded me, there was, I heard the story about somebody in the UK, he was a lawyer. And he said, I can't take these medications anymore because they affect my cognition so much. My memory is just disappearing. So he stopped taking the medication overnight, and he just seizing. And he's like, okay, now I get it. I have to take it. Yeah. And I think it's a really common issue, but I understand what you're saying. I think probably statistically in more rural areas, and it's probably higher, right?
So that's why we need a lot of awareness programs. We need digital tools. We need enhancement of the whatever we tell them, the compliance, the side effects of the medications. We need to tell them that this may be there, but you need to weigh your risk and benefit. What is more important for you is that you don't have seizures. The other things, you can do certain lifestyle modifications and curb it to a large extent. We don't say that it will not be there. So some medications have weight gain. Some medications do have a little dullness and drowsiness. But then in a general category, you can have a quality of life which is as good.
And remain alive. And, just to be black and white here.
Yeah, you can have a seizure any point of the day, while you're traveling, while you're getting down the stairs, while you're in the washroom. I give them such instances that it's not the seizure per se, it's the seizure where you have it. And that's going to be a big problem. You can have a head injury, you can have a fracture, and they're going to live with it for the whole life, apart from having epilepsy, which could have been easily manageable with a single medication taken morning and evening.
Do you know what? I fell on a railway line during rush hour once during a seizure. I'm lucky to be alive, and so it can happen to anyone in any place. Do you talk about when you're educating people and and prescribing and diagnosing, do you talk about symptoms other than seizures as well? Because often it is other aspects like the mental health issues which are so common amongst us. Do you speak to many people about that?
If I am speaking to a community of persons affected by epilepsy, yes, I do. I talk to them about the sleep hygiene. I talk to them about the compliance. I also talk to them about the mental health, about the brain health, how they should be keeping it active. the amount of brain which is active, energetic, and as I said, with more dopamine, you will see that your seizure levels, your threshold for seizure also changes, and you can have a very fruitful life.
And they need that inspiration. And because I think generally, often globally, if you hear you have epilepsy, it's like, oh, it's all bad and my life is over, but not necessarily, right?
No. We also encourage them to take part in various activities, be a part of the society, come up, empower yourself, especially the women. I see to it that if the parents are wanting to get her married, I will request them and probably put in a little more force rather than requesting, I should say. It's a forceful request, I will say. I will tell them that first let her complete her education and be in a position that she can have a job at any point in her life if she needs to. After that, get her married. Yeah, just don't get her married, because after marriage, if it happens that the family, the in-laws get to know, and then there is something wrong with the marriage itself, she would be able to mend to her own life if she's on her feet. So empowering women is one part of it. I do this EduVan, educating women about neurological diseases, EduVan project. In that, I tell them that any woman in your household, neighbors, anybody there is, try to see to it that she is first completes education. The treatment part, let the doctor, family, and the patient go about it.
Yes, and you know what? I think that makes lives better for those who aren't women as well. You know, you have a healthier society in general, and greater equality, and higher levels of education, and that's great for the economy and society. So I just think it benefits everyone.
Completely second that, because the amount of perceived stigma also becomes less. Because if you are doing a job, you are educated, you are at par, you are par with many other people, probably more than many other people in the society, then epilepsy is not something which you have to be afraid of at all.
Your empathy for people affected and families affected, and seeing the wider picture of the epilepsies and how it affects society is so valuable for us, because too often, and understandably because of, lacking funding and time, people will go and see their neurologist if they're lucky enough to have one, and that's it. They don't, have anyone who says, okay, do you know what this is? I understand how this affects you, your family, your career, your wider future, perhaps.
And also, Torie, as you put it here, because sometimes it's practically difficult for every person to come and meet the doctor at frequent intervals. They tend to forget. So we had from the foundation devised this Epilepsy Help App. I'm not sure whether it can be downloaded globally, but in India, we have it in 3 languages. Torie, you must be knowing that we speak so many languages in India.
So many. My brain couldn't cope with it. I don't know how you do it. Like from the age of, 6 months old, you guys are learning multiple languages, right?
Being multilingual should reduce the risk of dementia in us. Let us see how it goes by. So even in a particular state, Torie, if you move from one part to another part, the dialect changes, the language may not change, the pronunciation and how it goes. It's a little difficult to sometimes understand, but it's really lovely, whatever said and done. So we had this Epilepsy Help App, Torie, which is very frequently used by my patients. They keep all their data. It is secure. It doesn't get transmitted to the doctor and the consulting. It's in 3 languages, English, Hindi, and Telugu. And they also have an alert feature there where they can put in a phone number of a person nearby. And if they're having an aura, they can just click on it. The location goes to the person and the person can address it as fast.
That's really cool.
So I feel that patients using it, they feel little, again, empowered of their disease, that they are safe. The family members, if the particular patient is in a hostel or in a far-off place, they feel that they have fed the number. I'm not sure whether it is really helping them, but then at least it's a sense of confidence that we instill. And all the data of the patient is in his hand, the mobile they carry everywhere, so that even if he's in a different place and he gets a seizure, every image, the doctor's prescription, the tablets which have not worked for him, everything is there in that app. So patient gets to is confident that even if he's in a faraway place, he can communicate to any doctor at that place. Torie.
Thank you so much to Bindu for her inspiration today, showing us that massive challenges can be broached and that slowly but surely, working together, we can improve the lives of people affected by the epilepsies all around the world. Do check out more about Bindu and her work on the website torierobinson.com, where you can also access this podcast, the video and the transcription of the entire episode all in one place. And if you haven't already, please don't forget to like, comment and subscribe to the channel, and share this episode with your friends, your colleagues, your family members, the person from the corner shop, the people from university, your local GP, schools, the person that you meet down the street, anywhere, because this all supports our mission to decrease the discrimination faced by and improve the quality of life of people affected by the epilepsies around the world, and also get everybody appreciating the incredibly cool epilepsy research that is out there. See you next week.